And Microsoft is really proud to be supporting this Healthcare Data Innovation Council, comprised as it is of over 30 members from 20 institutions and 11 countries across the world. And it really is groups like this that we need that represent different perspectives, different geographies, different parts of the healthcare ecosystem to come together in a way like this. And so we are very excited to be a part of that at the company. Today we're at this event here in our office in Brussels, and it's just incredible to hear the stories from these healthcare professionals at this event who are talking about, on the one hand, their excitement, what they can achieve as professionals in addressing some of the most complicated healthcare challenges of our time through AI, through cloud services, but also about some of their frustrations in connection with some of the challenges and obstacles that prevent the adoption of technology in this context. And so the conversation today really is about how do we work together to find solutions and a way forward.
The work of the Healthcare Data Innovation Council is foundational. The Council has brought together very diverse perspectives, and all of the participants brought their stories. The story of researchers, the story of scientists, the story of law, and the barriers and the opportunities that are still faced in sharing data.
Some concrete example of AI in the healthcare space. AI is quite an emerging technology, is a technology which is mainly based on data and is bringing innovation to any field, and healthcare makes no exception for that. There are very interesting projects which are happening. Like I could cite, for example, the AI for leprosy, which is a project which have been conducted in South America, in Brazil precisely, where they gather lots of images from skin lesions and they can create models that could predict if that lesions effectively is led into leprosy or not. And this allows the detection and the early diagnosis of leprosy in any place by just having a smartphone, which is pretty powerful.
I think transformation requires most and foremost trust. So we spend a lot of time thinking about the governance model and what needs to be the governance model that would create this element of trust and will allow all the stakeholders to share their perspective and find these common solutions.
We are living under the false impression that we have healthcare data, and healthcare data is available. But when you start a project and you try to use data for artificial intelligence, for example, the first thing you realize is the scarcity of healthcare data, the lack of open datasets available, and this probably is the first thing that we have to solve as citizens.
Data is going to become the asset of these healthcare systems. Now, but there are some challenges around that. One is the fragmentation of the regulation that can reduce the innovation. But also there is the fact that the regulation are meant for individual data, not for big data.
We're faced with two main issues. First of all, legal fragmentation. In order to access to data, we have to apply national law. And to process data, we have to apply national law. It regards aspects like anonymization, consent from patients, and different approaches regarding retrospective and prospective studies. Then, if you need to process data in a cross-border research activity, you need to apply some different laws. And you need to apply in these cross-border research activities different guidelines from different data protection authorities. It means that you have to employ a lot of time dealing with legal issues, and this is a problem. How do we solve the problem?
As a practitioner, I see that the systemic complexity is huge and it impacts two areas: legal interoperability, how people are covered across health systems, and organizational interoperability, how people in organizations collaborate outside across their boundaries. The Nordics have been traditionally seen to have a high degree of collaboration, high trust in government agencies, and that is used by industry players and actors to drive collaboration initiatives. So the Nordic Interoperability Project is one such event, which is grassroots driven bottom up, but it is supported by the Nordic Council of Ministers. So the Nordic Innovation, which is the arm of the Nordic Council of Ministers, helps such projects come together. And then you have cross-border discussions and solutions emerging from that collaboration. So I'm hoping that that model can help other areas look at collaboration rather than competition as a source of innovation.